welcome back to Yankee Chronicle. I'm your host, Abby Peel, coming to you from the Lake Sunapee region, VNA and Hospice, a wonderful organization and supporter of YCN. And I'm now joined by their president and CEO, Jim Culhane. Hello, Jim.
Hi, Abby.
It's been a little bit since we've done a check-in. I guess we saw you last at Women Who Make a Difference back in May. Cannot believe that was in May.
I know, several months ago already.
That could have been last week
Such
if you asked me.
Event. Yeah,
wonderful event.
It was great. It was well done.
There's always so much happening at the VNA, but always good to do a bit of a check-in with you a few times a year.
Yeah,
What's new here?
You know, there's a few things that are new. I will say, maybe I'll start out on the very positive note that we were recently recognized for our patient satisfaction in our home care and our hospice programs. Patient satisfaction is obviously a core attribute and requirement for us to monitor and measure. And it also gives us the appropriate feedback in terms of how we're doing. And a company that we contract with that oversees our patient satisfaction surveys recently recognized us as being in the top 20% nationally for both home care and hospice services with patient satisfaction scores.
Amazing.
Yeah, we're excited about it.
That's exciting. Yeah. And any other big update? I mean, we always talk about employment with you guys too. I mean, that's a one that you always have openings, it seems, because it's always a need. You're always in need. But how are things going in that department too?
You know, things have been better. I wouldn't say things are wonderful at all, but I would say that we've been blessed that in the last 18 months, being able to find the quality staff that we look to hire, whether we're talking a nurse, a physical therapist, or a licensed nursing assistant. We've seemed to have adequate applications come in, so it allows us to continue to really do what we want to do and complete the services. As a lot of organizations did, there was some contraction in the COVID years, and blessedly our staffing has returned to a level that's really allowed us to expand and move into the areas that we've wanted to return to. So we've been really fortunate with that.
Is the VNA just an organization that's always growing? I mean, as you're in a population of people that retire here and grow old here, but I'm sure you always just feel like we got to add more, add different, something like that.
So I always say that we're about one person short of where we ever want to be, and we never arrive there. And primarily, that's somewhat driven by the fact that New Hampshire is as well known as the second oldest state in the nation and is getting older. The number of people that are over age 65 is growing significantly every year. And that, by definition, usually means that we are expanding our services to meet the increasing needs of the communities that we serve.
I'm always fascinated every time we touch base with you guys, too, of all the different departments, and then in those departments, really unique things that you offer, like a music healer can come to a bedside of someone in hospice, and that's always such a fascinating part to me. I mean, I think you just think of nurses and LNAs here, but you are looking for some very skilled people. Yeah,
we are, and you know, that raises a good point, which is, you know, hospice is a very important program to us, and that has been in a program that I'm glad to say we've been able to, again, add staff to allow us to continue to expand. Our mission, especially in hospice, is to help people stay at home at the end of life, and having the ability to do that and expand upon that has been really important. But a common misunderstanding is that hospice is a medical program, which is certainly true. We have a nurse practitioner, a physician, and lots of nurses. But it's a much more holistic program that takes advantage and really focuses on the psychosocial well-being of the individual, not just the person that's in our program, but their family as well. So in addition to the medical staff that we also have spiritual care, social work, we see massage come in, we see music come in. So it's a much more holistic approach to really kind of get to where the patient's at and help them towards on their journey at the end of life.
And then the support that you give the family after the fact, right? I mean, that's another whole part of it too that I learned when we came. Is it November Hospice Month?
It is.
When we came one November, and I couldn't believe how much I learned about it, but that, you know, you can do a lot of pre-planning and talk about what you want with services here at the VNA. But then after the person passes, there's so much support that the VNA offers the family, which is incredible.
Yeah, that's one of the major perks, I think, when people do decide that they want to take advantage of hospice, is after a family member passes, that we provide bereavement services for over 13 months after the individual passes. Not everyone takes advantage of it. Everyone has a different support network.
Sure.
But it is available, and we do promote it, and we do try to assist people as best as possible, and that goes on for over a year.
Incredible. Yeah. Shifting gears just slightly before I let you go, it's about to be Medicare time, and I was going to let you talk about the upcoming enrollment period.
Yeah, I really appreciate you bringing it up, Abby. So Medicare open enrollment starts in mid-October, goes through early December. This is is a really important time. The past few years, we've attempted to do a lot of community education because these are really important decisions that people make. I think, unfortunately, we live in a time where a lot of consumers are in receipt of just a little bit of information. They get the brochures, they get an email, they get a text that tells them the variety of plans that are out there. But they're making pretty significant decisions about their health care coverage, whether they should stick with traditional Medicare or whether they should take advantage of Medicare Advantage plan. And we've been, again, in the past few years, really trying to educate the communities to do the research, see what plan works for you, up to including retaining traditional Medicare, which is a very broad and generous benefit. Some plans are better than others. Some plans are better than others for different people and their different needs. So we're really entering into a time where we're hoping people begin to think about what they need from a healthcare standpoint, do the research on what a benefit does and doesn't cover so they can plan accordingly, because healthcare insurance is crucial these days.
Absolutely. Can people reach out to the VNA to find out more and
absolutely
lend a helping hand?
Absolutely. And we'll, again, usually in September, we'll start sending out some information, some flyers and some mailings just to help people and really raise the level of awareness that's required for them to understand and help people navigate some of those complex journeys.
I'm certainly not on Medicare, but healthcare as a whole is just a confusing, signing up for insurance, all those things. It's amazing. So I'm sure it'd be wonderful for people to check in with you and have your assistance. Jim Culhane, President and CEO of the VNA, thank you so much for hosting us and always checking in.
Thanks, Abby. Great seeing you.